In 2019, the Sunyani Municipal Hospital recorded 8 infant deaths. In 2020, it dropped to 2. The facility has not recorded any infant death in 2021. In 2019, the facility recorded 2 maternal deaths. It increased to 4 in 2020. However, there is no case of maternal death at the facility in 2021. However, despite the success chalked by the facility by recording 0 cases for both maternal and infant deaths so far in 2021, the facility is not resting on its oars but empowering its staff through regular in-service training. It has collaborated with Rotary Club of Sunyani Central to train some selected staff. President of Rotary Club of Sunyani Central, Johnson Chagli Awomauli, has been sharing details of the training.
Basically, some time ago, the Rotary Club of Sunyani Central and our partners in Canada decided to equip the Sunyani Municipal Hospital with medical equipment. And as an area of focus for the Rotary Foundation or Rotary International, we have an area that basically deals with child and then maternal issues. And so based on that, we decided to equip the newly built maternity block with medical equipment in relation to only child and then maternity issues. And so by this, the municipal hospital also has programs that they run for those who deal with the neonatal issues. And so by so doing, realized that they've been running that until sometime they said they ran out of cash to do those programs. And as part of this project that was done, this training, that is neonatal resuscitation, also forms part of the training program so that it will equip the nurses or those who work in relation to children to know the new trends of neonatal issues. Again, this place being a referral center, we equip them so that those from the neighboring towns could also have a fair share of the assessment to those facilities. Because realize that somebody may come from, let's say, a town nearby with a neonatal issue, and then it will be very difficult for the municipal hospital to even address it. But currently, as it stands now, we can say on authority that they are fully equipped that they can handle neonatal issues.
The staff who were trained in neonatal resuscitation were taken through topics such as foundations of neonatal resuscitation, preparing for resuscitation, initial steps for newborn care, and positive pressure ventilation. Some of the participants have been sharing what they learned with Citi News.
It has really been beneficial to me in the sense that we have learned today that if we are able to resuscitate our newborns well, we will prevent some neurological damages in newborns when they are growing up.
In fact, we've learned a lot for the past 3 days, but one particular thing that I'm taking home and to help with my practice as a nurse is the difference between the neonatal resuscitation and that of the adult. With the adult, you only do chest compressions when there is no pulse. But with the neonate, if the pulse is less than 60 beats per minute, you start your chest compressions.
We've been reminded of how to do proper positioning during a PPV, that is positive pressure ventilation, and also how to do effective chest compressions, and at what stage you are supposed to give medications during neonatal resuscitation.
From today's training, I've learned that about 1 to 4% of neonates will need PPV or ventilation after birth. And if I'm able to give correct or appropriate PPV to this neonate, it means Ghana will record no neonatal death.
The medical superintendent at the Sunyani Municipal Hospital, Dr. Robert Akun, on his part urged the participants to put to good use the knowledge they have acquired.
My advice for everyone is that whatever we've learned here in terms of the neonatal resuscitation, we are going to put it into good use, and then let's be critical in our resuscitation, especially the first minute. Because if you are going to prevent future disabilities and cognitive impairment, It depends on what you do initially. We shouldn't rest. We should also keep on reading and updating ourselves in how to resuscitate our neonates. The equipment too, we should take good care of them so that it can last long. And we are supposed to give a report of up to 2 years to our Canadian partners so that when they see that we've taken good care of the equipment that came, they are willing to help us with more.
From the Sunyani Municipal Hospital, I am Michael Safonifum for Citi News.